A dental crown is placed over a damaged, heavily decayed, cracked, or root canal treated tooth to protect and restore it. A bridge replaces a missing tooth by anchoring to the adjacent teeth on either side. If left untreated, a cracked or decayed tooth can fracture beyond repair, develop a painful abscess, and lead to bone and gum loss. Neighboring teeth will shift and tilt into the empty space, collapsing your bite. Alternatives include implants, removable partial dentures, or monitoring. We will discuss what's appropriate for your situation. Every crown and bridge procedure involves permanent, irreversible removal of tooth structure and cannot be undone. Post-preparation sensitivity is common and usually temporary, but persistent sensitivity needs attention. The nerve inside the tooth may become inflamed either before or after the crown is placed, requiring root canal treatment. This is not always predictable. Crowns and bridges can fracture under excessive force or grinding. If the remaining tooth is very short, for example after decay or fracture, a crown lengthening procedure or orthodontic extrusion may be needed to expose enough healthy structure to hold the crown properly. The single most important factor determining how long a crown or bridge will last is the quality and quantity of the tooth structure that remains. No guarantee of 100% success. Your compliance, home care, and bite all influence the outcome. Crown and bridge treatment typically requires at two or more appointments. The first visit involves a thorough examination, including x-rays and bite assessment. If root canal treatment or crown lengthening is necessary, that is usually addressed before the crown preparation. Sometimes the necessity of root canal may be addressed later during the temporization or even after crown setting. Please understand the upfront determination for root canal is difficult for a certain situation. At the preparation appointment, the tooth is permanently shaped under local anesthesia, impressions are taken, and the temporary restoration is placed. It generally requires 1 hour or 90 minutes. The dental laboratory fabricates your custom crown or bridge, usually taking 1 to 2 weeks. At the final appointment, fit, bite, and aesthetics are carefully checked before the restoration is permanently cemented. Clinical case photos may be shown at a chair during consultation. Post-treatment care begins immediately after tooth preparation. The temporary crown protects the prepared tooth between appointments. If it comes off, call us right away as the tooth can shift and become sensitive. Brush gently, but do not floss during temporization, and avoid hard or sticky foods on the temporary side. Attend your final cementation appointment on time. Missing it may mean the crown no longer fits properly and the case may need to be redone. Sensitivity after preparation is normal and typically fades, but persistent sensitivity or pain beyond a couple of months should be considered as a case of root canal treatment. If you grind your teeth at night, a night guard is strongly recommended to protect the crown long term. A loose or chipped crown should be reported to us promptly. If a crown or bridge fails, the treatment pathway depends on what has happened. A loose or dislodged crown should be addressed immediately. Keep it clean and call us the same day. A fracture may be monitored or repairable if minor, but major fractures usually require a new restoration. If the tooth inside the crown becomes painful or develops an abscess, root canal treatment is performed, followed by recrowning. Depending on the elapsed time since cementation, additional cost may apply. Gum recession exposing the metal margin of a crown can be addressed usually with a new crown or sometimes a gum graft. In the most serious cases, where the supporting tooth fractures below the gum line or bone is severely lost, the tooth may be extracted and an implant or new bridge plan is developed, early intervention always preserves more options. Contact our office at the first sign of any problem. Still, you have more questions. We are here to answer. Thank you.